Dear audience, thank you for joining me in my 6-month progress report on my PhD thesis titled Oncoplastic Breast Surgery and its Clinical Significance. I'm Loretta Nyirády, a 5th-year medical student and an MD PhD student at the Department of Surgery, Transplantation and Gastroenterology. My mission is to aim for perfection in breast reconstruction, and my vision is to find the best technique or techniques which result in the safest oncological and also the best aesthetic outcome. Here you can see my 2 ongoing projects, and I'm excited to share some insights into them. Let's begin with the first one, which is investigating the safety and effectiveness of volume displacement and replacement techniques in oncoplastic breast-conserving surgery. Breast cancer occurs in millions of women, which could affect not only their physical health, but also their mental and sexual well-being. However, with breast reconstruction, we could earn them back their health, emotional well-being, and also their self-confidence. Here you can see the 2 distinct techniques which we use in oncoplastic breast-conserving surgery. Firstly, the volume displacement, utilizing local breast tissue, and then the volume replacement, using perforator-based flaps. And my aim is to compare these 2 techniques and their outcomes by answering the clinical question, which is the safest and most satisfactory method in oncoplastic breast reconstruction surgeries. Involving the population of women underwent breast-conserving surgery, the intervention groups are volume replacement and volume displacement, and for the outcomes, I would like to examine the patient satisfaction and also the oncological safety. We hypothesize that reconstruction with volume displacement is associated with better outcomes. Here you can see my systematic search, which we conducted in 3 different databases. In the first domain, you can see the interventions, and in the second part of it, there's the oncological breast-conserving surgery and its synonyms. So after the systematic search, we ended up with more than 17,000 articles, and after the full text selection, I only have 47 eligible full texts. For the most crucial outcomes, which are overall satisfaction and oncological safety, there's an ongoing analysis, but I have some preliminary results for complications and dissatisfaction. Here you can see the pooled proportion for dissatisfaction after oncoplastic breast-conserving surgery. Many women are afraid of dissatisfaction because this affects their sexual life and their mental health. Here are the 2 subgroups, volume displacement and volume replacement, with an overall patient number of 865, 365 in the volume displacement group, and 500 in the volume replacement group. If we look at the confidence intervals, we can see that these are overlapping. And even if it's a little bit of an overlap, we can say that there's statistical significant difference between the 2 subgroups regarding dissatisfaction. And it's also clinically relevant because in the volume replacement group, the rate for dissatisfaction was 13%, which is 2 times higher than in the volume displacement group, where it was only 7%, with an overall dissatisfaction rate of 11%. Let's move into the second plot, which is hematoma complication. Here we also used proportions for the unit, which ranges between 0 and 1. The overall patient number was 2,377. These results weren't statistically significant. However, these are clinically relevant because between the 2 subgroups, there is no difference regarding hematoma. In both of the subgroups, the hematoma rate was really low, with an overall rate of 4%. Of course, our study has its strengths and limitations. We included every single intervention, but unfortunately, these articles are only single-arm studies. And because we would like to see the patient satisfaction, which is a subjective outcome, the risk of bias is really high, but it's the nature of these studies. However, we try to stick to rigorous methodology and comprehensive design. So my preliminary results suggest that these techniques are equally safe regarding the complication rate, but the volume displacement techniques show slightly better dissatisfaction outcomes. So that's why volume displacement should be preferred, and women should be always informed about the dissatisfaction rate and the complications, even if it's a low rate of these. But for these, we need more RCTs, articles with strict methodology, and the universal patient satisfaction tool. For example, BreastQ would be a really nice questionnaire. Here you can see the progress of my first project. I'm currently working on my manuscript. I'm done with the introduction and methods part, and I would like to submit my article during May. Let's move into my second project, which is investigating the safety and effectiveness of polyurethane breast implants compared to alternative ones in reconstruction after mastectomy. Not only every 8th woman has breast cancer, but it's the second leading cause of death. That's why mastectomy rates are increasing. Here you can see that in a study between 2008 and 2020, the rates increased from 10% to 25%. And until these days, it has a strong stigmatizing effect, which can be mitigated by reconstruction, earning pleasing results and a better quality of life. Here are the different indications for mastectomy, and I would like to highlight the most important ones. For example, if the tumor is larger than 50 millimeter, or if there are multiple malignant lesions, or if it's a local recurrence. Let's move into the polyurethane implants, which are regular silicone implants coated with polyurethane foam. These show promising results both in acute complications like hematoma, infection, or seroma, and also in later complications like capsular contracture or implant rotation. And last but not least, the overall patient satisfaction is much higher and better with these polyurethane implants than with the alternative ones. That's why I would like to compare the different implant-based techniques and their outcomes, which leads us to our clinical question: which implant-based reconstruction demonstrates the lowest rate of complications and also the most satisfactory outcome in patients undergoing mastectomy? Here I would like to compare the polyurethane implants with the non-polyurethane implants, and I would like to see the outcomes, complication rate, and patient satisfaction. We hypothesize that polyurethane implants are superior to alternative implants, and our clinical implication is to promote the use of implant-based techniques after mastectomy by understanding the most suitable approach. So in summary, these are my two ongoing projects, which are two crucial areas of oncoplastic breast surgery. So the first one is volume displacement and volume replacement in oncoplastic breast-conserving surgery, and the second one is the safety and effectiveness of polyurethane breast implants compared to alternative ones in reconstruction after mastectomy. I would like to thank you for your attention with my quote, which is, "Every turn in life is a chance to shift into something extraordinary." Thank you.
Thank you very much, Loretta. Thank you. It's time of questions.
Congratulations, Loretta, on your great progress being an MD PhD student. I have seen that in your first forest plot, the last study had like around 42% dissatisfaction. It was the highest among volume displacement therapy. Have you checked? I can see that the number of patients included is very low. However, have you checked what was the reason of it? What is this extended glandular flap? Is it something very different from other types of mastectomies, other types of displacements?
Thank you very much for your question. Yes, this is an outlier of my forest plot, and we need to really check out this article and maybe wrote an email to the author, Ogawa, because something's not right with that article, surely. But these are preliminary results, so we are waiting for the satisfaction rate, which is critical for us, and also the oncological safety, and we'll see after that. Thank you very much.
Thank you.
Thank you for your wonderful presentation. I have a question regarding your first project. You have mentioned the hematomas. Were there other complications besides hematomas, and what are?
Thank you very much for your question. Yes, we are investigating more complications like fat necrosis, infection, dehiscence, and so, yeah. Thank you.
I have maybe a clinical question. I'm not an expert in the field, but who decides actually? Is it the surgeon or the patient who choose what kind of replacement they want?
Thank you for your question. Usually the surgeon decides it. Yes.
Okay. My second question is how the dissatisfaction was measured among all these studies. Is it like yes or no, or is it a questionnaire, or?
No, there are many tools and questionnaires we use, like BreastQ and other questionnaires, and they could rate it from 5 to 1 or from 10 to 0. So this is how we measured it.
And was the mean of these questionnaires available in the papers?
Yes, fortunately, yes.
Mm-hmm. And did you think to investigate actually the change in the satisfaction among the studies?
Not yet, but I think we're gonna do it, yes.
Yeah,
if you suggest it, then... Yeah.
That's worth analyzing, because here we can see like a yes or no, I think, right? Like here's the event numbers, yes or no?
Yes, kind of, yes.
Yeah, but if you investigate the actual score, like you can see the change, how much actually it changed.
Yes,
in
yes.
between the
and for that we are waiting for the satisfaction outcomes, because, you know, if someone is satisfied, that it doesn't mean that the breast is perfect, because it ranges from excellent to moderately satisfied to fair and to dissatisfaction. So
exactly, yeah.
That's why we should wait for the results.
Thank you.
Thank you.